and welcome to my article presentation on the third scientific e-conference of Texila American University. The topic of my research article is to determine awareness of leadership roles in nursing management among the nurses in Consolata Hospital Nkubu, Meru in Kenya. My names are Sister Catherine, Joan Kawira Munndi, a principal in Consolata Nkubu School of Nursing. So for the study, the researcher at 47 nurses took part in the study, of which were composed of enrolled community health nurses. These are certificate holders, and there were 18 respondents, accounting to 38%. Then registered community health nurses at diploma level were 27 nurses, and this is presented by 58%. And Bachelor of Nurses, Science nurses were 4%, and that is 2 nurses. And the nurses in this study who formerly trained in leadership roles, as the topic reads, were only 15%, while 85% had not had any formal training. So in the study reviewed that there is knowledge deficit and practice of leadership roles among nurses in Consolata Hospital Nkubu in Kenya. The importance of the study was to determine the roles of nurses, to improve nursing management among nurses in Consolata Hospital. So the reason why the researcher decided to do this, it was realized that in Consolata Hospital Nkubu, many nurses or the nurse readers are not really knowing or recognizing their roles as readers. And at the end of the day, they are doing so many nursing activities that can be delegated to other nurses. And at the end of the day, they are very tired, but they have not accomplished the objectives of the day as leaders or leaders in nursing. And that was done with the following objectives. This was to assess the knowledge of nurses on leadership in nursing management, to determine the practice or the level of practice on leadership roles in nursing management by all nurses, thus all the cadres of nurses, as we have mentioned earlier, were presented, and also to identify the challenges that they face or faced by nurses at the Consolata Hospital Nkubu on leadership roles in nursing management, and how to resolve these challenges. The background of the study was the researcher looked on leadership as it is creating a long-term strategic vision, enabling people to work towards change. And it involves developing a shared sense of mission, tackling political, organizational, and resources barriers, and inspiring and motivating others. So leadership here is meant to create a change or for the purpose of achieving the objectives or the goals of nurses as managers. And also, the effective leadership management, being a complex environment, requires management and leadership. But in this case, leaders are not necessarily managers, but managers can be leaders. What we mean, or what the researcher meant, is that the good manager can be a reader, but not all managers can be readers. And an example that the researcher came across, it's when this nurse, one of the nurse leaders, was interviewed, and the nurse expressed that she was vented so much, a nurse vented her frustrations with the systems, policies, and work overall situations that cripple the practice of leadership roles. She described how she is overwhelmed with ensuring quality management, application of hospital policies, attending to emergencies, acquisition of resources, and ensuring appropriate use of the resources, planning, organizing, coordinating, controlling, as well as staff-student guidance or instruction. She is also involved in record keeping, like issues of inventory, controlled drug acts, and or register, and modulating the nursing care and medical treatment for patients, report writing, and presentation. So looking at this or listening to this nurse, surely she is overwhelmed, or mostly as a presentation of all those the activities of leadership, then it was difficult to accomplish. The study design is a descriptive cross-sectional research design that was used, and in this part, the design, or according to Mugenda 2008, the major purpose of this type of design is to describe the state of affairs as it is. Hence, it is most appropriate, or it was most appropriate for this kind of study. The study was carried in Consolata Hospital Nkubu, which has several wards or several departments, and sampling design was and procedures. The researcher used the census, which was very appropriate because the whole population of nurses was the sample size, or was interviewed, and data collection. The researcher prepared questionnaires which were given to respondents as self-administered questionnaires. Then data analysis was statistical package of social science version 207, where we find that there is or entails coding of the questions that were asked, then followed by analysis and reporting. Then the results: the nurses with formal education on leadership roles in nursing management were only 15%, which was a very small number, and 79% of the nurses felt that they had inadequate application of the knowledge on management due to shortage of time. 95% who were presented by 35 respondents demonstrated that democratic leadership style was the most preferred in Consolata, followed by transformational leadership presented by 80%. In conclusion, there is inadequate knowledge on leadership roles in nursing, and that we have seen because the presentation of those who have formal education on the nursing leadership roles is only 15%. There is inadequacy of professional training and education on leadership roles in nursing, which is a big challenge facing the nurses. And all cadres of nurses should learn managerial leadership roles for effective and efficient care of the patients. The future plans. So the researcher recommends that the administration to empower and encourage the nurses to achieve higher education. Consolata Hospital Nkubu nurses to have self-motivation and initiative to upgrade through continuous professional development. The administrative nursing officers to identify opportunities for seminars and workshops on leadership. The nursing administration to delegate to staff nurses responsibilities so that they can exercise their leadership roles, which was somewhere in the research scene. Then the induction of newly recruited nurses on leadership roles in nursing. Thank you.